Hello, my name is Dr. Hillel Mazansky, specializing in medical hypnotherapy, guided visualization, nutrition, and exercise. Today's health tip is entitled, Doctor, Why Am I So Tired? The medical term for tiredness is called lassitude. There are many causes why people feel chronically tired, some of which are poor nutrition, drinking a great deal of coffee, depression, anxiety, stress, sleep apnea, which is a condition where the back of the throat falls over the windpipe and interferes with your sleep, gluten sensitivity, underactive thyroid, heart disease, diabetes, and many more. However, the most important cause usually of chronic tiredness or chronic lassitude is depression, anxiety, and stress, and chronic fatigue syndrome, which is called CSF. We do not know the exact cause of chronic fatigue syndrome, but it might be related to mono, to gluten sensitivity, and to other conditions. CSF, or chronic fatigue syndrome, presents mainly in females, and they are constantly tired, they awake tired, and they go to sleep tired. Depression is the hallmark of the disease. They are extremely depressed. And you have a vicious cycle developing. When you have depression, you don't want to move, you just want to lay around. And laying around and doing nothing oftentimes aggravates the condition. Females outnumber males with this condition. It is actually, there's no specific test for chronic fatigue syndrome, but it is done through exclusion of everything else. In other words, you have all tests, blood tests, etc., and your thyroid is checked to make sure it's not a thyroid issue, and other blood tests, a test for mono, a test for gluten, etc. Well, once you have chronic fatigue syndrome, what can you do? You can empower yourself to try and exercise as much as possible. Your depression, anxiety, and stress is obviously treated by medical hypnosis because there's no medication for chronic fatigue syndrome. We do not recommend that those who have depression, anxiety, stress take any medication because they all have side effects. And practicing holistic medicine, we believe we can treat all the symptoms of chronic fatigue syndrome, depression, anxiety, and tension using medical hypnosis and guided visualization. If you have such a syndrome, please do not hesitate and wait and see, but go to your physicians and get it checked out. So at least they do all these blood tests to rule out the problem. On my website, drmedicalhypnosis.com, you will see there are plenty videos for insomnia, for stress, anxiety, depression, etc. Why not empower yourself to assist in your own treatment by using hypnosis and guided imagery? My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.